Gonorrhea. It's one of the most common STIs on the entire planet, but it's also, one of the most misunderstood. It can be totally silent, it's getting tougher to treat, and its impact is absolutely global. So today, we're going to break down exactly what you need to know about it. Okay, let's get into it.
First up, let's just talk about the sheer scale of this thing. The World Health Organization estimates there are over 78 million new cases of gonorrhea worldwide every single year. Just let that number sink in. It really puts into perspective just how common this infection is.
But a number that huge just brings up a ton of questions, right? Like, what is this thing? How does it spread so well? And what are we actually doing to fight back? Well, that's exactly what this is all about. We're going to figure out the what, the why, and the how of gonorrhea.
We've got a pretty clear plan. We'll start with the basics, check out the numbers, then dive deep into the biology of how it gets into the body. We'll cover treatment and the huge problem of resistance, talk about the serious complications, and then wrap up with how to prevent it.
Okay, so first things first, what is gonorrhea really? To get a handle on the disease, you gotta start with the tiny organism that actually causes it.
At its heart, gonorrhea is a bacterial infection. Simple as that. It's caused by a specific germ that loves to set up shop on the moist, mucus-lined surfaces in our bodies. We're talking mainly the genitals, rectum, and throat. It really can't survive for long outside the body, which is exactly why it's passed through direct sexual contact.
Let's zoom in on the bad guy itself, Neisseria gonorrhea. It's a gram-negative diplococcus, which is just a fancy scientific way of saying it's a pair of little sphere-shaped bacteria. And under a microscope, they're often described as looking just like tiny pairs of coffee beans. Its main travel methods are, of course, sexual contact, vaginal, anal, and oral. But what's super important to remember is that it can also be passed from a mother to her baby during childbirth.
So now let's pull back and look at the big picture again. We know it's common, but who is really getting it the most? The data shows some really clear patterns here.
So, while really any sexually active person is at risk, gonorrhea hits young people the hardest. For women, the highest rates are seen between the ages of 15 and 19. For men, that peak is a little older, from 20 to 24. This just goes to show what a major public health issue this is for teens and young adults.
Now here's one of the biggest reasons gonorrhea spreads so effectively. It's often a completely silent infection, especially in women. Get this, up to 80% of infected women might have zero symptoms at all. In men, it's the total opposite. About 90% will show symptoms. This huge difference is why testing is so critical. You just can't wait for symptoms to show up to know if you or a partner has it.
Okay, so we know what it is and who it affects. Now let's get into the biology of it all. How does this little bacterium actually get in, take over, and make you sick?
Think of it like a four-step invasion plan. First, the bacteria use these tiny hair-like arms called pili to latch onto our cells. Once they've got a grip, they start multiplying like crazy, forming little colonies. Then they start releasing toxins that actually damage our own cells, which helps the bacteria dig in deeper. And the final step? That's our body's response. The immune system freaks out and sends a flood of white blood cells to fight back. This massive battle is what creates that thick, pus-like discharge some people get.
Now, not all infections are created equal. Doctors basically put them in two boxes. An uncomplicated infection means it's localized. It stays put in the area it started. But if it goes untreated, it can become complicated. This is when the bacteria escape into the bloodstream and start traveling all over the body. It can cause serious problems like skin rashes, arthritis in your joints, and in really rare cases, life-threatening infections of the heart or brain.
And that brings us to a huge topic. How do we fight this thing? We've got antibiotics, but the problem is, Neisseria gonorrhea is an incredibly smart bacterium. It's become a master at resisting our drugs.
Yeah, because of all this resistance, the old days of just taking a simple pill are pretty much over. The international standard right now, recommended by the CDC, is a single, strong shot of an antibiotic called ceftriaxone. They even adjust the dose based on your weight to make absolutely sure it's powerful enough to knock out the infection.
And this isn't just an American thing. If you look at a national example like the Indonesian guidelines, they show the same global trend. They also prefer the shot. And while an oral antibiotic is still on the books as an alternative, it's just not as reliable anymore. Another really smart part of the strategy is that doctors will often treat you for chlamydia at the same time, because it's super common to have both infections at once.
And this quote from the CDC really just says it all. We are facing a huge challenge. This isn't just about finding the right drug anymore. It's about trying to stay one step ahead in a race against an organism that is evolving super fast. Drug-resistant gonorrhea is a major public health threat.
And that threat of resistance makes it even more important to understand what happens if this infection isn't treated, or isn't treated the right way. The consequences aren't small. We're talking about serious, permanent damage.
For women, untreated gonorrhea can travel up into the reproductive organs and cause something called pelvic inflammatory disease, or PID. This can create scar tissue in the fallopian tubes, which can directly cause infertility or a very dangerous ectopic pregnancy. For men, it can cause a painful condition called epididymitis, and in some rare cases, that can also lead to infertility.
And the risks just keep coming. Having gonorrhea can actually make it easier for you to get or transmit HIV. A pregnant woman can pass it to her baby during birth, which can cause a terrible eye infection and even blindness in the newborn. And like we talked about, it can lead to that life-threatening infection that spreads through your blood or joints.
So, with all these serious risks, prevention is obviously the way to go. Let's wrap up with the most important things we can do to protect ourselves and everyone else from this infection. First, if you do get treated, there is a simple and absolutely critical rule to remember. It's the 7-day rule. You have to wait a full 7 days after you've finished all your medicine before you have sex again. This gives the antibiotic time to completely clear the infection, so you don't pass it on or get it right back. But of course, the best strategy is always prevention. And the most effective ways are pretty straightforward. Using condoms correctly every single time you have sex, and being in a long-term, mutually monogamous relationship where you've both been tested. On top of that, just having open, honest conversations with your partners and your doctor, and getting regular STI tests. Those are the cornerstones of staying healthy.
And that really brings us to our final thought. We're living in a time where bacteria are evolving faster than we can keep up. The challenge of gonorrhea isn't just about our personal health anymore. It's a global race. And as this tiny little bacterium gets smarter, it forces us to ask a really big question. How are we, our science, our public health policies, and our own personal choices going to evolve to stay one step ahead?